Hi, this is Diane Greco-Allen, a food relationship coach, and we're going to go over a little bit about assessing your child or someone for dehydration, and then looking at what these underlying causes might be that's causing various degrees of dehydration. So most of the time you're thinking about your mucous membranes, which is inside your mouth and in the lower portion of your gastrointestinal tract, your skin turgor, which is, how quickly your skin comes back. Sometimes if your skin's very loose and then it can form into even like a crease, that might be an issue around dehydration. Percent of weight loss. A lot of women gain and lose weight around their periods, and sometimes extreme weight loss can be associated to issues around dehydration. And then we'll look at some of those root causes. Urine output, how much are you urinating, how frequently, and sometimes those can go from one extreme to another where you're not urinating that much. And what's causing you to retain water. So there might be more to this. Checking your pulses, even, the pulse that you check in your wrist, is it a bounding pulse? Is it, because it's the circulatory system and how much the heart is being used to get this fluid around you, and whether or not there's enough volume in your circulatory system, or if some reason there was a big shift from the circulatory system maybe into the intestine. So what's going on in your blood vessels and why? And then what's going on in those spaces in between the blood vessels and your cells. Okay, so then we're also looking at blood pressure, whether it's high or low, what's going on behind that blood pressure. Jugular vein distension. That's a big sign that maybe there's some backup, constriction, some reason that the jugulars are a little bit enlarged, and usually sunken eyes. I don't know if they have that. They do have sunken eye sockets. That can be a sign of dehydration. And these can go from extremes of one way or the other, where there's swelling in the body and then it goes the other way. And we'll get into why that's occurring. Lab values, your electrolytes are all around this. And so this is talking mostly about sodium, but sodium is attached to chloride. And then you want to look at some of the other electrolytes that are involved with some of the functions in the glands, and we'll talk about that. Neurological status and level of consciousness. If you're weak and tired, something's going on, you're unclear and foggy, maybe you're dealing with some electrolyte imbalances. And if you think about when you sat in a bathtub too long and how you turned into, like they'd say, you turned into a prune, and you look at your fingers and your toes and see what that looks like. And if they're soft, if they're supple, if they're, swollen, what does it look like for your fingertips and your toes? Do they look shrunken? Okay, so those are signs that you're not retaining the water the way you should be, and that there's some imbalances going on. So in that level of consciousness, now, if you think about it, when we were all raised on canned soup, we were taking in a ton of sodium. And still today, in a lot of the prepackaged foods, there's a lot of sodium in there that is the wrong type of sodium, or it's just excess amounts of sodium. So, and that can cause some major issues with your organs. After a long chronic period of time, your body has to adjust to these extremes of too much and too little, going back and forth. Thirst is a big sign. Now, we think about thirst with dehydration, but it also comes along with diabetes. And so you want to think about, why am I so thirsty? And when you think about sugar, Sugar is like an osmotic, and it will take your electrolytes into different places because those electrolytes follow that sugar around. It's like a big cycle in there, and it's like a roller coaster ride. So, think about how much sugar you're taking in and how that's affecting your electrolytes and your blood volume and your weakness and your mental status, whether or not you're getting swollen brain or shrinking brain, and what's going on and why you're so sensitive to things. And it might be that your electrolytes are way out of balance and that you're not getting not just enough. It's not about drinking a ton of water. It's about understanding throughout the day how to moderate the foods you're eating and the drinks you're drinking, and then knowing, how they affect your body and that blood volume in the circulatory system, because the heart has to keep up with everything that you're doing. And if you're putting a ton of sodium and sugar in your body, your heart has to figure out from all the different, we'll talk about which glands are affected, because these are triggers to hold the sodium back, to hold water in, or to release it. And your kidneys play a major role in this. And some people are dealing with early kidney failure. Gray toxic overall appearance. You might see this in people that are severely dehydrated, chronic dehydration. And not only are they dealing with both, the IBS type thing where you're getting chronically constipated, but you might be chronically having loose stools and you're going to the bathroom more than normal per day. So when we talk about dehydration, it's an imbalance caused by loss of a significant amount of body fluid, and it's associated with vomiting, diarrhea. They say GI suction, but you're being suctioned for some reason. What is it? Fevers. The fevers come for what reason? Because you're dehydrated. And there is, when you think about the pituitary and the glands in the brain that control the hypothalamus and how they connect and coordinate with each other with the temperature, that's your thermostat area. And you want to know why this thermostat is going so high. Sometimes it's because of dehydration and fever, and related to maybe imbalances with gut microbiome and maybe exposures to viruses and so forth. But you also want to think about diabetes. Like I said, it's called diabetes insipidus. Overuse of diuretics. Now, what are diuretics? They're not just the pills you take over the counter. Sometimes they're or prescribed. Sometimes it's your food, because when you start looking at food as medicine, you may be overdosing on specific foods that act as a diuretic. And then you have to figure out how to cut back on that caffeine, or some of those creamers. You might be using a ton of creamers in your coffee, and they might be acting as diuretics. There might be some of the onions out there, anything that's in the FODMAP diet plan that's recognized as these types of foods that act as gluconics or something of that nature that pull water here to there. So you want to think about those things. And then excessive sweating. Excessive sweating can be like, you can do that at night. Your body is getting rid of something. Now, sometimes if you have too much sugar in your body or too much excess of anything, you have some toxin or something, your body's trying to get rid of it, either through the bowel or the urine, or through runny nose, or coughing, or your saliva. Your body's doing it for a purpose. And the sweating, everybody thinks that that's the only way to detox. Well, sometimes you're forcing these issues, and sometimes you just have to monitor what you're putting in and what's coming out of your body. And if you don't get enough fluid through either your foods or drinking your water every day, then that can definitely affect your mental status and many other issues. Significant depletions of body fluids and disturbances in his serum electrolytes can cause some really damaging problems over a long period of time. And that's why they were so insistent of reminding people not to overdose or overuse or abuse some of the products that are over-the-counter products for constipation. Now, a lot of people that have major eating disorders might see some of these issues, but you want to think about thirst, mucous membranes, urine output, the pulses, the hypotension, lethargy, coma, and even death. Now, just recently we saw that Matthew Perry died, and he was someone who had dealt with alcoholism early on and really took some drastic measures. But I believe that some of these electrolyte imbalances can be misunderstood and lead to some very acute scenarios. And I believe that possibly because he was in a jacuzzi, you want to think also about these magnesium soaks and things like that, how often, how frequently, and how long you're in the water. So, you know, those types of things. And I just wanted to bring that up. I want to send out good energy to anybody that watched Friends, because I know this affected a lot of people, just like Suzanne Summers, and anybody that had these people as a part of their life. These sometimes were replacements. These people were replacements for family members maybe that they couldn't connect to, and they saw someone on TV that they could, and they became a part of their life. So I just want to send out condolences and well wishes to people that are grieving throughout this time around Matthew Perry's death. And I followed him on his journey and send loving wishes to anybody that was a colleague of Matthew Perry, because that is in that show, Friends, I believe almost everybody knew that show. So dehydration is a major source of morbidity, illness, immortality, death, and in youth children around the world. And some of these misunderstood scenarios can be related to some of the problems that we see around watery stools, how many you're having a day, excessive vomiting, bleeding, persistent high fevers, infections such as rotavirus, Shigella, or amoeba, side effects of medications such as penicillin. Penicillin is a mold, so remember that, and your body reacts to these things, and sometimes it's in an aggressive way. So I want you to just remember that when you think about your body, there's mild, moderate, and severe levels of dehydration, and you just want to know that things that are happening, palpitations with the heart and your pulse, thready pulses and weakness and things like that are related to electrolyte imbalances, sodium, chloride, phosphorus, potassium, and then there's magnesium and calcium. You want to think about how all these work together with what we're introducing as foods in our body. I wish you well. I hope you'll think about how that dehydration works with you and your family. I am sending condolences out to anyone who has lost a family member to an acute heart attack that may have been caused from a dehydration situation, or anybody that has had a scenario where something happened, right, related to COVID that might have been as a result of dehydration. Diane Greco-Allen, food relationship coach. Please subscribe to my channel, ring my bell, and please mention anything that you would like in the comments below. I'll put some information in there because I get a lot of my information from the nursing manuals that I still review, even though I was a nurse in the past and now am a functional medicine and nutrition counselor. Thank you so much.